He'll kind of give us the down low of what happens at the Best Friends Blood Bank.
Hi, thanks for having me. So my background is I graduated from University of Illinois in 1999. I did a one-year internship in emergency critical care, following that in Milwaukee, Wisconsin. And I did 2 years of a critical care residency there as well. And I moved down south, was an emergency veterinarian at Cobb Emergency in Marietta for 3 years, and senior emergency veterinarian at Georgia Vet Specialists in Sandy Springs for about 5 years. During all that time, I noticed there was definitely a need in the Atlanta area for a local blood bank for pets. I work emergency shifts, and we would sometimes run out of blood, and getting blood overnighted from out of state is not always convenient for your patients. So in 2011, I decided to start a local blood bank here called Best Friends Blood Bank. It's located in Decatur. We pretty much just service supply blood to Georgia. There is a blood bank at UGA that they use for their own purposes, but this is the only other blood bank in the state of Georgia for any other vet or practitioner who needs to give blood products to their patients. I'm going to start with a little bit of background of transfusion history in general. And interestingly, the very first transfusion at all in any species was actually dog to dog. That was done in 1665. It was the first successful blood transfusion in England by physician Richard Lower. Pretty much at that point you have dogs next to each other side by side with a tube going from one dog to the other. 2 years later was the first transfusion that was done in people. That was actually a xenotransfusion, transfusing sheep blood to people. Directly, again, the sheep sitting alongside next to the person getting the blood. Then about the 1800s, the first successful blood transfusion from a human patient into another human occurred, and it was someone who was bleeding out with postpartum hemorrhage. And it was 1818. During that time also, there was some experiments going on with transfusion of milk in place of blood, and those experiments didn't go so well. 1901, Karl Landsteiner was an Austrian physician who was doing research and discovered blood groups in people, the 3 human blood groups. 1914 was the onset of anticoagulants, which then allowed them to preserve the blood, so you didn't necessarily need to have your donor and recipient sitting side by side. 1941, the Red Cross began the National Blood Donor Service, and that was to collect blood for the U.S. military. That was the first time there was ever any sort of widespread blood donations and blood storage, and it was primarily going to soldiers on the battlefield. At the end of the war in 1948, the Red Cross began the first nationwide blood program with civilians coming in to donate blood for other civilians. It wasn't until 40 years later, 1988, that the first animal blood bank was started. Stan Carlin developed that in Michigan, and that's still in existence now. It's called Animal Blood Resources, and it's the largest blood bank in the country. It has the original location in Michigan as well as another location in California. So when people hear what I do, or mostly when people bring their pets in to donate blood and they tell people where they're going with their dog or cat, people are shocked. They're like, I never realized that dogs or cats could need blood transfusions and that happened, but it happens quite a bit. And there's lots of different indications, reasons for that. Trauma is going to be the first thing you think of. A dog running out, getting hit by a car would definitely need some blood if there's hemorrhaging going on. Parasites as well. Flea anemia is common in small kittens and puppies. So if there's a very high parasite load, the fleas digest the blood and can make them anemic. Hookworms are an intestinal parasite that attach to the lining of the intestines and digest blood and can make animals anemic as well. Other parasites can be found in the blood. They're usually transmitted through flea or tick bites, and the most common one is called mycoplasma in cats. It used to be called Hemobartonella, but it's been reclassified, and that's a blood parasite that latches on to red blood cells and destroys the red blood cells, usually through a reaction of the immune system. Poisons are another indication for blood products. Rodenticides is very common, so The most common rodenticide that we see is warfarin. It's what's in decon. It's made to taste very sweet so that rats and mice will ingest it, and therefore dogs and cats will ingest it. Cats may also ingest they can get poisoned secondhand. So if a cat eats a mouse that ate rat poison, that cat can start hemorrhaging. So what the rat poison does is it prevents your liver from making your clotting proteins that your body needs to form natural clots, and without that we can see spontaneous bleeding. Zinc toxicity is another poison that can sometimes cause damage to the red blood cells. Cancer, very common as veterinary medicine has progressed and science has progressed, and people can be a lot more aggressive with treatment of their animals. We see things like lymphoma and bone marrow neoplasia that are managed sometimes with blood transfusions in addition to chemotherapy. Sometimes the chemotherapy itself has side effects as far as suppressing the bone marrow, and animals may need blood transfusions during the course of their treatment. And bleeding tumors is very common in dogs that get tumors, most commonly called hemangiosarcoma, which are tumors of the spleen. They can get tumors in their spleen, around their kidneys, or on their liver that can spontaneously bleed out and require blood transfusions while animals are being prepped for surgery. Bleeding gastrointestinal ulcers is something that veterinarians see a lot. Dogs are very sensitive to side effects of medications called non-steroidal anti-inflammatories, which are drugs like aspirin and ibuprofen, and dogs can get stomach ulcers from that, either from owners giving it against the advice of a veterinarian or a dog eating a bottle of pills that it wasn't supposed to. We do see bleeding disorders, congenital bleeding disorders in dogs, things similar to hemophilia in people. The most common one that we see is something called von Willebrand's disease, and that prevents platelets from attaching to each other to form blood clots. And so Dobermans and German Shorthair Pointers are the most common dogs that's seen in, but it really can be seen in any dog. Usually it's going to be a purebred dog, but it could really happen in any dog. And so those dogs sometimes need extra clotting factors in their blood to help them, either if they're going into surgery or sometimes they'll just have spontaneous bleeding. Usually it's diagnosed in animals when they're puppies. Sometimes when they start teething, they can start bleeding if they don't stop due to this congenital hereditary disease. Pancreatitis is something that we see in dogs pretty commonly. Usually in dogs they get that from eating something very rich and high in fat. Very different from people. People typically get pancreatitis if they're drinking too much, so college students, be careful of that. But in dogs, sometimes there's something that's very high rich in fat, and if the pancreas gets very inflamed, there's some extra proteins in plasma that can help calm it down and be part of the treatment process for that. Probably one of the most common use of blood products in dogs is for something that's called hemolytic anemia. It's part of a category of diseases where the immune system starts attacking your body, and certain parts of your body your immune system doesn't recognize and thinks doesn't belong there. So diseases in people like myasthenia gravis, lupus are diseases of the immune system where the immune system starts attacking part of the body. Well, dogs commonly get that where their immune system starts creating antibodies and attacking their red blood cells. And the treatment for that is going to be immunosuppressive drugs to weaken the immune system and try and stop that reaction from occurring. But these dogs often require sometimes multiple blood transfusions while we're trying to manage their disease. Chronic kidney disease is something that can sometimes require transfusions. Your kidneys create a hormone called erythropoietin that stimulates your bone marrow to make red blood cells. As your kidneys start to age, they make less of that hormone, and your bone marrow doesn't have the stimulus it needs to create red blood cells. We do give that hormone to animals that need it. We can give it to them as an injection, but sometimes that can take some time, and in a crisis, they may need a blood transfusion in the meantime. So we can use plasma as what's called a colostrum substitute. So colostrum is when a mother is giving milk to puppies, and that milk is very high and rich in antibodies. So if you have a dog that underwent an emergency C-section and the mother didn't make it, or for any reason the mother's not around and you have puppies that did not receive those antibodies, we can give them plasma, which have antibodies in it from a donor dog, to keep their immune system strong while they're that young. Tarlow is a virus that affects dogs, usually puppies. It's something that dogs get vaccinated for, so they can be protected from it, but we see it a lot in shelter dogs, stray animals, where they get really bad vomiting, diarrhea, and also damage to their white blood cell count is low because the virus destroys cells that divide very rapidly, like lining of your intestines and your white blood cells. So we use plasma in these puppies usually because their protein level is very, very low from all the vomiting and diarrhea, so we replace that protein to help keep their blood pressure up. There's antibodies in there for their weakened immune system, again, that can help them fight off other infections. Severe wounds, sometimes things like burn victims, they can lose a lot of protein through their wounds and injuries, and we can give them plasma in those cases as well. So we'll talk a little bit about blood types. We're going to start with cats. Cats are going to be more of what you think of with dogs. This is my cat. This was her picture as a kitten. Her name is Beatrice, if you can guess her blood type from her name. So about 90% of cats in the United States are blood type A. And then we have probably about 5 to 10% that are blood type B, like my Beatrice. And then less than 5% are rare, called AB. There are certain breeds that have a higher proportion of type B, like Beatrice, who's a British Shorthair. So we see Devon and Cornish Rexes and American, British, and exotic Shorthairs. There's more likely to be B blood in those lines. Blood types in dogs are very different than you think of in blood types in people. So dogs have proteins on their red blood cells. They're called dog erythrocyte antigens, or DEA. So there's lots of different proteins. So there's DEA 1.1, DEA 3, DEA 4, 5, 6, and 7. So a particular dog can be plus or minus for any of those proteins. So you can have a dog that's DEA 1.1 negative, DEA 3 positive, 4 positive, 5 negative, 6 positive, 7 negative. So there's all different combinations of blood types that makes it very, very difficult to give an exact matching blood type to a dog. The good thing is that unlike people and unlike cats, dogs are not born with antibodies against different blood types. So an A cat has antibodies in their blood already against B red blood cells. So if you give an A cat B red blood cells, they're going to have a reaction. If you give a DEA negative dog a DEA positive blood, you won't see a reaction right away because there's no antibodies there. We need some time for the body's immune system to develop antibodies, and usually that takes 5 to 7 days. Most of the time, by that point, your recipient of the blood is out of their crisis. Hopefully, if they were bleeding, hopefully 7 days later they're not bleeding and their red blood cells count is fine. So you may see a little bit of a delayed reaction if you gave them a different blood type, but it's not typically something life-threatening. Where we get concerned is animals that need multiple blood transfusions. Because after the first transfusion, now that recipient's body has been exposed to different blood types and has antibodies, and you could see reactions the second time around.
Can something like that kind of be associated like with the RH factor in a mother who she's RH negative and then she's going to have an RH positive baby?
Yes, and we
it's
can
not a threat until the second child?
Yeah, and we can see that in cats. We can see that in cats with the AB blood type. What they found in dogs is that the blood type, the blood between the puppy and the mother doesn't really mix. So there's been studies where they've looked at mothers who've had several litters of puppies, and they've not found any antibodies against different blood types. Years ago, they used to say if a dog has had puppies, she would not be a good blood donor because she could have antibodies against different blood types, so she shouldn't be a blood donor. And then they've actually looked at that, and they found that not to be the case.
So what would be the evolutionary advantage of dogs not possessing pre-existing antibodies against different blood
What
types?
would be the evolutionary advantage? That I don't know.
Okay. Sorry.
I'll think about that.
So then, are you guys still conscientious about like which blood type you're giving a dog, or does it not really?
Yes,
Okay.
yeah, we are conscientious, and there's definitely a preferred blood type.
Okay.
So of all the different DEAs, 1.1 is the most important because that one can create a very strong reaction in the second time around. So that's that creates the strongest immune reaction. DEA4 creates the weakest immune reaction. So if you have a dog that doesn't have DEA4 and you give it DEA4 once and you give it DEA4 again a second time, you might see a little fever, maybe some hives, but nothing serious. If you have a dog that does not have the 1.1 protein and you give it the 1.1 protein in a transfusion and then you give it that a second time around, you could see a severe reaction with destroying your red blood cells and what's called hemolysis. So actually the preferred blood type is going to be 1.1 negative. So we prefer that in our donors, but we do take blood donors of all blood types. And actually, the only blood type that I measure in the donors is 1.1 because that's the strongest one. The other proteins, I don't really measure. There's not even a commercial test to measure that in dogs. They can check it for research purposes, but they really don't keep track of that as important as the 1.1 antigen. So as I said, so there's not a universal donor the way we would think of with people. There's just the preferred blood type, which is actually going to be 1.1 negative and 4 positive. And we say 4 positive because 90% of dogs have that anyway. If they do have a reaction to it, it's going to be pretty minor. The 1.1, about 50% of dogs have it, 50% don't. So you think dogs come in all different sizes and shapes, and you would think that blood types would correlate with breed, and we see that a little bit.